Good evening, everybody. My name is Lixing Lao. I'm professor of acupuncture in the Virginia University of Integrative Medicine. Thank you for the invitation and good evening, everybody. My name is Lixing Lao. The topic of my presentation will be evidence-based acupuncture on pain management. I would like to declare that I have no conflict of interest on my presentation at this conference. And we know acupuncture has been used for thousands of years in China and other Asian countries. There's many legendary persons who believed to be the founder of acupuncture and Chinese medicine. Fu Xi is one of the legendary figures who believed to create the acupuncture needles and also the ETAM diagram known as yin and yang. So many ancient literature also demonstrate the acupuncture charts and figures. And they indicate acupuncture meridians is internally connect to the internal organs and externally connect to the limbs and the surface. Acupuncturists usually insert the acupuncture needle into different acupuncture points to influence the human body to achieve the homeostasis, as well as to balance the yin and yang. As we know, acupuncture and Chinese medicine have been used for many, many years and are considered the ancient healing art. However, the community often raises the question whether there's any scientific evidence of acupuncture. In 1996, a paper published in the British Medical Journal about definition of evidence-based medicine. It's defined that evidence-based medicine is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. Also, Dr. McCare also published a paper on the level or strength of the efficacy evidence. It is believed that, or agreed, a randomized controlled trial is the gold standard to assess the evidence. And systematic review of the RCT or meta-analysis is considered the highest or strongest evidence. The earliest paper on acupuncture clinical trial published in 1826 by Dr. Franklin Bache about 200 years ago. After treating about over 10 patients, Dr. Bache concluded that acupuncture possesses remarkable power in removing and medicating pain. In 1997, National Institute for Health held a consensus conference on acupuncture. The panel concluded that there was clear evidence and promising evidence showing acupuncture can treat adult post-operative pain, post-operative dental pain, and nausea and vomiting. Some other promising evidence show acupuncture can treat other pain conditions, menstruation cramps, tennis elbow, fibromyalgia, arthritis, and headache, and so forth. Since then, over 4,500 new clinical trials of acupuncture have been published. Commonly reported acupuncture clinical trials on pain-related disorder and the disease, including chronic pain, pain in general, headache, migraine headache, dysmenorrhea, labor and pregnancy pain, osteoarthritis, rheumatoid arthritis, and other joint pain. In 2014, US Department of the Veterans Affairs published a statement on the evidence map on acupuncture. Among over 1,000 citations, the author found 183 systematic reviews met their criteria. And they found that the majority of the paper published about acupuncture on pain management. If you look at this chart at the right side, indicate evidence of positive effect. In acupuncture, they clearly show that chronic pain, migraine headache, and headaches show the evidence of a positive effect on acupuncture. And many other pain conditions like cancer pain, and ankle sprain, and osteoarthritis also have evidence of potential positive effect. In 2004, University of Maryland School of Medicine published a paper on the annals of internal medicine that on effect of acupuncture as an adjunct therapy in osteoarthritis of the knee. The study recruited 570 patients and randomized into 3 groups: real acupuncture group, sham acupuncture group, attention and education control group. These 3 groups simultaneously through 8-week treatment of twice-a-week acupuncture treatment, followed by once-a-week and every other week treatment, and once-a-month treatment until 26 weeks. And sham acupuncture and education have similar regime schedule. These are the points that published for this knee arthritis. The patient was blinded to the treatment assignment, so they are not able to observe the needling technique in their knee. Outcome measurement, we used standardized Womack osteoarthritis index to measure the pain and function. In secondary outcome measurement, we used the patient global assessment and also quality of life, Stanford SF36, also measured adverse effect. Results show that at 8-week, acupuncture shows significantly better than control in pain and function improvement, and is all the way lasts until the 26 weeks. And also the data showed acupuncture significantly better than control in pain management, started at week 14 and all the way to the half a year later. Second outcome showed that acupuncture significantly greater improvement in patient global assessment compared to sham control, and no adverse effect was observed. In 2010, Mausberg and other authors published a paper from Germany on the acupuncture for chronic shoulder pain. They would like to determine whether traditional Chinese acupuncture is better than conventional orthopedic treatment for chronic shoulder pain. We also recruit 424 patients randomized into 3 groups: acupuncture group, sham acupuncture group, and conventional orthopedic therapy in multi-center study. And you can see acupuncture was 6 weeks, 15 treatments during the 6 weeks, and sham acupuncture have similar schedule. And conventional orthopedic therapy had a very active treatment with 50 milligrams diclofenac daily, and physical therapy, physical exercise, and other therapies. These are the points they used in shoulder area, and also points for sham acupuncture. The results showed that the red color is the acupuncture group, yellow color is sham acupuncture, and blue color is conventional orthopedic therapy. So after the 6 weeks of treatment, acupuncture group had near 70% of the patients had 50% of pain reduction, as compared to sham control and conventional orthopedic therapy. There's significant improvement. And this same results remains after 3 months without treatment. Acupuncture group still remains very high numbers. About 65% of patients had 50% of pain reduction. Linda in Germany also published a paper in the Cochrane collaboration database, a systematic review on acupuncture for prevention of tension type of headache, published in 2016. They found that the paper, the review paper had low risk of bias, mainly green color, and some of the high risk bias, mainly is a branding issue, because the acupuncture cannot be double brand. Mainly they have a single brand. That means the patients were branded to the treatment assignment, but the acupuncturist cannot be branded. So this is a forest plot. We can see that acupuncture, the results in favor of acupuncture on the left side, and in any time point, like 8 weeks, 4 weeks, 4 months, 6 months after the randomization, all show acupuncture significantly better than control in the number of days of headache attacks. In 2012, there's another article published in the Archives of the Internal Medicine by Andrew Vickers on the about acupuncture for chronic pain. This is the meta-analysis. The reason they also try to conduct a study, they want to determine the effective size of acupuncture for 4 different chronic pain conditions, such as spine pain, back and neck pain, osteoarthritis, chronic headache, and shoulder pain. Through over 900 different records, they identified 29 studies included in their reviews, including almost 18,000 patients. So the control group include all sham, different type of sham control, or conventional Western medical treatment. So if we look at the results, you can see these first plot from osteoarthritis, chronic headache, shoulder pain, musculoskeletal pain, all show the effect of acupuncture in all the results in favor of acupuncture in the right side, and significantly better than sham control in the left side. All fall into the right side. If you look at the number of the effective size, the range from the 0.15 of the chronic headache to 0.62 in the shoulder pain. The effective size is quite large. If we compare the conventional medicine, the drug for relief of pain for patients with sciatic pain, systematic review and meta-analysis published in same year, 2012, by British Medical Journal. From the first plot, you can see among about 20 trials, that the only 2 studies show that NSAID, non-steroid anti-inflammatory drugs, has slightly better improvement compared to placebo for the sciatic pain. The rest of the 20 papers show that no difference between the drugs, either antidepressant or opioid analgesic versus a placebo. There's no difference. Recently, in 2018, there's a paper published by Columbia University research team in the Journal of American Medical Association, JAMA, and they try to determine the effect of acupuncture compared to sham acupuncture and weight control group in joint pain related to aromatase inhibitors among women with early stage breast cancer. They randomized 226 patients into 3 groups: acupuncture group, and sham acupuncture group, and waitlist control group. And the treatment was 12 sessions. There were 226 patients who were randomized into 3 groups: acupuncture group, sham acupuncture group, and waitlist control group. The treatment was performed 12 sessions for 6 weeks. So they took 45 minutes each sessions. And the results showed that in all aspects, both the pain, the average pain interference, pain severity, all showed that acupuncture in the week 6 or week 12. Week 6 is right after treatment. Week 12 is the 6th week after the finish of treatment. And also acupuncture is significantly better in pain control compared to sham acupuncture and waitlist control in all aspects. Therefore, the author suggests that acupuncture should be used for this condition with a woman with breast cancer patient take the aromatase inhibitor to alleviate their joint pain. There's a near 30 clinical practice guidance recommended acupuncture for the one of the treatment options, such as low back pain, for neck pain, chronic pain, and many other guidelines. Thank you. I'll stop here for any questions. Thank you very much for your attention.